Hi everyone, welcome back to my channel. Today we're going to talk about your child's first dental visit, when it should be, how it should be done, and what to look out for. So first of all, by Australian Dental Association guidelines, all children should have their teeth checked before age of 2. Yes, you heard it right, by age of 2, because by age of 2, most of the baby teeth have erupted. So it's a good time to see your friendly dentist and make sure all the baby teeth are growing the right pattern, the biting is good, and also to check that there's no hole in the tooth. So what can you do to make your child's first dental visit pleasant and smooth? I'm going to share a few tips with you. First of all, make sure you bring your child's favorite toy with them, so they've got a buddy to support them and hold them onto. It's very nice and important. So we've got plenty of toys in the surgery as well, so it's in the play area so kids can play with them, just get used to the environment. Second thing, do some practice runs with your children. There are plenty of YouTube or iPad programs that you can use. Peppa Pig got the first dental visit, for example. Watch the show with them, and I think Oral-B has a lot of programs just explaining to children how the first dental visit is carried out, how to count teeth, for example. So I will put some links here and you can just click on them and share those little short videos with your kids. And I usually recommend just tell moms, hey, look, let's do a tooth counting game with kids. So when you're at home, when you brush your teeth, open your mouth, get your kids to count your teeth, and you do vice versa. So it becomes a little game for them. And when they come to the dentist, they simply do the same. Say, we're gonna play the game again. Let's open your mouth nice and wide. We're gonna count how many teeth you're gonna have. So that's something super simple, and if you do it a couple of times a week, the kids get used to it and know what's coming up in the dentist chair. Now when they come see the dentist, it is important that dentists introduce themselves and all the surrounding instruments to the kids. So I often say, look, we're going to do a game today. We've got a few friends that we're going to introduce to you. My little tooth dryer, just like mummy's hair dryer. My little Mr. Tickling, which is like a little probe that checks the teeth. And we've got, big mirror, something this big, and you get your kids to hold on to it. And the best thing is they can look into the mirror. So whilst the dentist using their smaller mini version of that mirror in the mouth and check their teeth, they get to see what's being done in their mouth. And that takes the fear components out of the visit as well. And of course, make sure you see a dentist or a children therapist. Make sure that you're comfortable with the person in office and professionals you're working with. That's always important. So what we do during the children's first visit, the kid get to lie on top of mummy's tummy, which is okay. I'm very okay with it. So mum gets to sit in my chair and the child sit on top of mummy's tummy. So the chair goes down and the kids go flatter with them, so it gives us a better angle and better lighting to see the children's mouth. So what we're checking is number of teeth present, number one. Make sure there's correct biting pattern on it. There's no cross bite or scissor bite or anything like that. We check the soft tissue such as gum, make sure they're in the healthy and happy color. And when we have a look at, I do this. I'm not saying every dentist do this, but I check their tonsils as well, because it's very important. I ask for parents about the kids' sleeping pattern, whether they're snoring, whether they breathe with their mouth open. The importance of that is, restricted or obstructed upper airway will hinder or slow down the development of your upper and lower jaw. Yeah, and you can then have the wrong pattern of bite of teeth together. So, if we come back to later on when the kids grow to 12 or 13 years old, and in orthodontics, they have crossbite, they have crooked teeth. Well, how did that occur? The history can well trace back to when they are 2 or 3 years old. So that's important for dentists to check. It's very simple. Get the kids to open really wide and eyes, and then I'll have a good look at their adenoids. Their tonsils. Adenoid is one tissue we can't see because it's further back up on your palate. So Usually we don't see that, but tonsil is something so easy. Just put the mirror in, have a look at them, have a chat with you about sleeping pattern, whether they snore, how they breathe, and that's a good starting point. And if there's anything we see that's not quite normal, we might get you to see a ear, nose and throat doctor just for a second opinion. So depends on how much plaque and build up there are on the children's teeth, and how cooperative, how comfortable they feel in the chair. Sometimes we'll give them a simple polish, just remove all the plaque and all the dirty things on the teeth. And the kids quite like it, because we say we're going to tickle the teeth a little bit, and you go around with some fun colored and nice flavored toothpaste all around, and just try to clean it for them, and they get used to the environment of seeing a dentist. And then last, we will apply some calcium tooth conditioner all around the teeth, just to make sure that strengthens and help to make the teeth super strong. So that's the whole visit of the child's first visit to see a dentist. It's very simple, very comfortable. One last thing is that before you go see the dentist, please don't describe dentist as a terrible sort of an office or environment to go to, because in child's mind they don't know who dentist is, and they don't know the environment of it, and more than likely they've got healthy teeth, so that when we see them it comes across as a pleasant, comfortable experience. They're willing to come back. And of course, we try our best to make sure you enjoy the journey with your child in our practice. That's all I want to say. In a separate video, if you subscribe to our channel, you'll get the latest information on how to keep your kids' teeth healthy, and how to look after their teeth, and how to check for the teeth growth, development as well. So you can press subscribe to our button so you're the first one to know all this information. I do have a separate video talking about children's diet, what they should be eating and what to look out for, how to prevent decay from happening. So feel free to click on the link here. Yeah, and you can see the other video. Thank you all, enjoy your day, and we'll see you next time.